Good evening, all. I'm Aditi Lamba coming to you from a remote location in New York City. This is the Wednesday night South Asian news segment, Vision of Asia, Voice of the Community. More than 92,000 people have died in the United States from the coronavirus, with more than 1.5 million cases reported. All 50 states here are partially reopening, even though 17 have reported an upward trend in new daily cases over the prior week. The world count of COVID-19 cases is nearing 5 million with 324,000 deaths. Looking at the tri-state now, New York will allow for Memorial Day ceremonies with 10 or less people, including vehicle parades. Also today, New York Governor Andrew Cuomo said that New York City's low-income minority areas have been hit the hardest from COVID-19. State of Connecticut is reopening some stores and businesses such as restaurants, offices, retail stores, but with restrictions. And in New Jersey, Governor Murphy said that the strongest testing program is the foundational principle for a road back, saying that more testing equals more people knowing their health status. We again urge all our viewers to continue maintaining social distancing and also allow time for frontliners to do their work. If you are a South Asian on the front line, do connect with us on events at itvgold.com with your story and your experience. Tonight, we continue to present healthcare professionals on COVID-19 measures and tips, along with more on reopening and celebrating the month of Ramadan. Here are the headlines. Tamania Jaffri on at Urdu Mom blog and Ramadan during COVID-19, Canada. Sai Pariwar Temple reopens to devotees and public, North Brunswick, New Jersey. Dr. Priti Jain on COVID-19 measures, impacts and social distancing, Long Island, New York. It's time for a short break on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. I'm Aditi Lamba and this is Vision of Asia, special report on the coronavirus pandemic. We have some positive stories today for all our viewers, as we believe it's important to appreciate and showcase gratitude, especially during these tough time periods. We recently spoke with popular Pakistani Canadian blogger and influencer who is committed to making Urdu language fun for kids and to celebrate cultural literacy, Tamania Jaffri. She's focused on key parenting skills for South Asian parents and multiculturalism, with an emphasis on learning one's own culture or regional language. She spoke with us candidly about the importance of imbibing our heritage into the youngest generations, along with her personal take on celebrating the month of Ramadan. She reflected upon the ways one may celebrate Ramadan during this pandemic at home and how to truly engage with our children to empower them. A truly positive story. Here is Tamania Jaffri.
What are the things that parents can do right now for Ramadan that you are sort of promoting through your blog? And also perhaps some tips for parents to be more engaged with their children while they're, stuck at home during COVID.
Yes, I feel really it's important to engage children in little activities. So what we did was we set up a Ramadan corner, which is sort of this little space where we have a countdown. So, we sort of say there are 30 days of Ramadan. So, so every day we do a countdown down to Eid. That is, of course, Eid is when the kids get presents. So that's something that they're really, really excited to. So that's one of the first things, you can do to attract children. Of course, gifts, Eid, that is something that they love. Countdown calendars is something that they can see visually. Then we sort of take that forward with putting all our books that we have on Ramadan, on the spirit of Eid, sort of putting that in the corner so the children know that there's this space where they can go, they can pull out a book, sit down and read it. We also have various activities that they can do. So we put up this tree, which is their Ramadan tree, where whenever they do a good deed, they sort of put that up, because this is a month to do good deeds. And it's so important to tell children that good deeds are really, like, they don't have to be like big actions, right? They're small. They start with good intentions and they're really small steps. So they're as simple as helping your parents in the house, helping a neighbor, writing a lovely note to someone, reaching out to someone who might be feeling lonely at this time. So sort of telling the children to pile up their good deeds during this month. So that is something that I talked about on my blog. I also try to share free resources for parents so that they realize that this is not something that is sort of, either expensive or too time consuming. I try to share resources for parents there where it becomes accessible and easy for them.
Right. And in terms of the resources and activities, let's talk about what can you do with your kid during Ramadan. I know there are some really interesting 3D cards that you were promoting and you had made with your daughter, but there is also these Urdu stories you do on your blog. There's a bunch of things that you're doing continuously, especially this month. Let's talk about what we can do and what you can share with our viewers to try perhaps.
Yes, so it's as you said, right, it's about engaging the children in different activities, especially now during this time of COVID-19, that the children are at home with the parents. So little activities which sort of underline the spirit of the month, which is like we made these 3D mosques, which were adorable for the kids, right? They actually put their little animals in them. They're in our Ramazan corner there. We also started making some Eid cards. So this is a year that we will not be able to meet. This year Eid will be very, very different, and Ramadan is really that countdown to Eid, that ultimate celebration at the end of this month of fasting. And so we started making Eid cards, and I have actually some of them. So we started making these pop-up Eid cards. This is a mosque that we made. So it was such a lovely way to engage the children and for them to realize that these are cards that we can actually just pop in the mail for our friends and family. And these are cards that I made with my daughter, and we put a family picture there, so that they realize that Eid is coming up, and while this year we cannot build up the anticipation in the ways that we had done the year before, this year we can make these Eid cards, and we can mail them out to our friends and family so that they get that in the mail. So we still sort of connected with them, not physically, but sort of we're still part of a community. During this last week of Ramadan, we've also been making these Eid cookies. So I'll just show some of them to you. So there's a
Wow.
mouse, there is a camel, and
That is
my
so
daughter,
interesting.
she's 9 now, so she's been decorating all of these.
उठो बेटा आंखें खोलो बिस्तर छोड़ो और मुंह धो लो इतना सोना ठीक नहीं वक्त का खोना ठीक नहीं सूरज निकला तारे भागे दुनिया वाले सारे जागे तुम भी उठो तुम भी उठो तुम भी उठो बाहर जाओ अच्छे वक्त का लुत्फ उठाओ
You were doing some incredible works with the Culture Tree, which
Oh,
is
yes.
an amazing nonprofit here, and we've also showcased them on ITV Gold. Talk to us about how that engagement has been with Culture Tree and what your own opinions are on the foundation, and what can we look forward to, because this coming Sunday there's an event happening and you are part of that with Culture Tree.
Oh, yes. So Anu Sehgal from The Culture Tree, she is doing an amazing job of sort of bringing together this cultural literacy and identity, and sort of giving that identity to our children. And I'm so happy that she sort of put together this amazing program for Eid around the world through under the initiative of The Culture Tree, and we're sharing lots of activities. So she sort of brought together a lot of artists. So she will have people displaying calligraphy. We will be sharing Eid traditions. We will be showing you how to make some Eid pop-up cards, how Eid at home looks like, and she will be taking over the Asia Foundation channels, and she will be showcasing that there. So the Culture Tree is doing amazing work, and I love the collaborative nature of all the work that we're doing in presenting a positive face of Eid around the world.
Yeah, and that's like so important. What are you going to be doing with them?
So on Sunday, which actually might be the day of Eid, Eid sort of goes by the lunar calendar, so you never know. It's always a surprise. Is Eid going to be on Saturday, Sunday, or Monday? It's always a surprise. So Eid probably is going to be on Sunday, fingers crossed. And so we will be sharing. So me, Anu, we'll be on the Asia Society, channels, and we'll be talking about what Eid at home looks like this year, right? Because we're going to sort of encourage people. What are some of the activities that they can do by just staying at home and just making it special for their families. So we've already sort of talked about how to make some Eid pop-up cards, send them in the mail, to your friends and family. But on Sunday, we'll be talking about how, this Eid at home is special and is something really for us to tell our later generations.
In New Jersey's center of worship, the Sai Pariwar Temple in North Brunswick has now reopened to all its devotees and public. The mission of the temple is to have a cultural and religious center for followers of Sai Baba with his messages of humanity, humility, and serving the ones in need. During the COVID-19 crisis, many have fallen back on their faith, and hence a place of worship such as the Sai Pariwar temple aims to motivate and strengthen the community. At the religious event, key individuals from the temple spoke with ITV Gold on standards of safety and measures in reopening of the Sai Pariwar temple. It also hosted a virtual ceremony through its premises for all its devotees, sending positive messages and prayer. Here is the story.
लैललोहिताय नमः वक्रतुण्डाय नमः शूर्पकर्णाय नमः हेरम्भाय नमः स्कन्दपूर्वजाय नमः वरसिद्धये नमः पुण्ये नमः परमेश्वराय नमो नमः नानाविधपरिमलपत्रपुष्पाः अक्षतपूजां समर्पयामि.
Right now, we are all going through a very bad pandemic crisis. But though the temple is closed for past 2 months, the priest comes every day in the morning at 9:30, and he does the abhishekam, archana, then he offers, the prasadam to all the deities, and he performs the aarti, then he goes away. And Thursdays are, as you all know, Baba's special day. So Thursdays also he comes, and then because of this pandemic, no devotees are allowed and no volunteers are allowed. So it will go for a few more days. But we didn't want, our pujas, abhishekams and archanas, to stop, and everything is being very smoothly run. Besides whatever every temple does, in our temple we have different activities, cultural activities, like we have singing programs, we have instrumental programs, we have dance programs, and besides that we have several health camps.
Welcome to our temple virtually. Very soon you will be able to come here like before and get the blessings of Baba directly. Now today is a virtual blessings, and we also request you to come and be part of it like before always. The one unique aspect of our temple is we have religious discourses. Anybody who is good in giving religious discourse coming from India, we encourage them, and they get a time slot and they come and give a free discourse for all the devotees. And then we also have dance programs, mridangam and other percussions. All, people are really, if you see some of the video cutouts that we will be showing in this program, you will be amazed to see what's going on in this temple. And apart from that, we also worry about the health of our devotees. So we give a lot of free services, dental camps, like 4 dentists, they commit every year, come 4 or 5 days on springtime, and then spend 5 hours here in the temple and check everybody with plastic disposables. And they don't treat, they just check and then give suggestions what they have to do. And more than that, the students from Rutgers University, they are the main pillars for our services. They come every Thursday almost these days, spend 5 hours, 5 or 6 of them, and they give lot of services. They check the blood pressure and various other things related to BMI indexes at the end.
Unfortunately, during COVID, with not many of us not able to come and pray Baba, but we are trying to organize a live streaming of Aartis on Thursdays. We will send you an email about the details and the link. so that you all can watch remotely at home and pray Baba.
It's time for a short break on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. This is Vision of Asia Coronavirus Pandemic Special Report, and I am Aditi Lamba. Today, New York Governor Andrew Cuomo said that despite hospitalizations, new cases of COVID-19 continue to decline. Starting this Thursday, religious gatherings of no more than 10 people will be allowed statewide, where strict social distancing measures are enforced and all wear masks. New York City is establishing a stockpile of sufficient PPE to support needs of hospitals, nursing homes, and others on the front line. Now, bringing more information on the impact of COVID-19 on the healthcare system, we spoke with Dr. Priti Jain, who joined us from Long Island, New York. Dr. Jain urged all to continue practicing social distancing and to take utmost care of their health while the nation is reopening. Here is Dr. Priti Jain.
So there are two types of testing. Grossly, there's antigen testing and antibody testing. An antigen is the piece of the virus that we test for. When somebody tests antigen positive, it means they have the disease for the most part. And antibodies are the second test, which is the antibody test. The antibody test, antibodies are little proteins, or almost like if you were to think of little missiles that your body makes to fight an infection. So all antibodies in our body mean is that that it means is that it's a sign of a prior infection. So there's antigen testing, which is done through the nasal swab, where we take a piece of the nasal secretions and we process that. If that tests positive, then that means you have the disease. If you test antibody positive, there are two types of antibodies, IgM and IgG. For sake of simplicity, I'm only going to talk about IgG, which a positive IgG antibody means that you've had the infection in the past. That's all it means. At this point, we don't know whether this antibody is going to give you enough immunity towards another coronavirus infection, how long the immunity is going to last. We don't know any of that.
Do you think people that are testing positive for these antibodies, are they now allowed to go outside? Could they mingle with their family members? Could they see, their grandchildren? What do you have to say about that?
So I think there's a lot to be determined about antibodies at this point. I think it's a great thing that somebody has antibodies, but like I mentioned earlier, having antibodies doesn't mean that you're immune to another infection, or we just don't know. We don't know whether it's going to give you immunity towards another infection. Maybe it's going to give you immunity towards one strain and not towards the other strain. So there is a lot to be determined in terms of antibodies and what kind of protection they're giving you. So my current recommendation to anybody would be, even if you're antibody positive, be a little patient, still carry on the social distancing, the mask, the hand hygiene, all of that stuff. Try and keep yourself isolated. All the stuff that you've been doing so far shouldn't really change because now you're antibody positive.
Could you give us some latest insight into the virus itself? And my question to you following up to that would be, is there a concern for a reoccurrence of this virus right now with the way the country is reopening, with the way we're seeing the economy reopen as well? What do you think is going to be the implication on the health crisis system here?
So I definitely think that there's a very good chance that we're going to see a resurgence of this illness, as well as an increase in the number of cases as we prepare to open up the country. So reopening or lifting the lockdown is a very fine balance between having our economy run and keeping people safe. And it's a decision that the government makes. I think nowhere in our history has there been a greater time to kind of display more personal responsibility as of now, which means that even if something reopens, or even if the entire country reopens, the virus is still there. The virus hasn't gone anywhere. And I don't want people to start thinking, because the government said that we can now go out and go about our normal business, that the virus has disappeared. It hasn't. The virus is still there. All it means is that we still need to practice the same measures that we were practicing now, which is social distancing, hand hygiene, masks. And, there's a good chance that once again, if the number of cases rise exponentially, there's a good chance that we may have to go into lockdown again. So we just have to be prepared for that.
What are the requirements from a medical point of view to reopen the nation?
So honestly, there are no requirements from medical. I mean, there is obviously a lot of stuff going on from the medical point of view, but strictly from a medical point of view, there aren't. I think the whole thing about the curve, more than the lockdown, more than the reopening, was the fact that we did not want to overwhelm our medical systems, which is why sooner or later everybody is possibly going to get infected. But instead of the curve going up exponentially, we wanted the curve to flatten out. So if this was the hospital capacity, we wanted the flattening to remain below the hospital capacity so that the hospitals could take care of the patients. So what happened was, initially it was like this, so we exceeded our hospital capacity. And that's why, so many people unfortunately could not receive the care that they needed because our hospitals were overwhelmed. So I think from a medical standpoint, that is the only concern, that at no point should we overwhelm our medical system.
And that is all for tonight's episode. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. Remember, you can also now subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from a remote location in New York City. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.